Welcome to Digication Scholars Conversations. I'm your host, Kelly Driscoll. In this episode, you'll hear part 2 of my conversation with Kyle Hewson, Vice Chair and Clinical Associate Professor in the Doctorate in Physical Therapy program at Stony Brook University. More links and information about today's conversation can be found on Digication's Twitter, Facebook, and Instagram. Full episodes of Digication Scholars Conversations can be found on YouTube or your favorite podcast app. I feel like the role of physical therapists in healthcare is so different than the kind of relationship that one has with a doctor, for instance, where you have a really kind of defined period of time that you're with them. And sometimes physical therapists you may work with for months or years and really become your partner in rehabilitation. And you spend a lot of time together often, depending on the extent of rehabilitation needed. Mm-hmm. And it really does become a more personal relationship, I think, because you have that amount of time together. And you're often having a lot of time together when you as the patient are in pain and already vulnerable because of that. And they become, your cheerleader and your support person. And as you mentioned, also your teacher, because they're trying to give you the tools to be able to kind of take care of yourself when you're not right there with them and educate you on why certain movements or exercises or even breathing technique, are so important in your healing. And I was curious, as the students are kind of going through the program there, is this kind of storytelling something that's encouraged with their patients? Because I think it's something that we don't often hear about with doctors, for instance, if it hasn't, because of the limited time that you're with them, really.
Yes.
Yeah.
I think there's two parts to it. I think that we want to get, I think all the things you said are spot on. I mean, the sense of we want to encourage, we want to know them more. So we want to hear about we say that every patient, a diagnosis can be very similar, but their role in life, they could be a mother. They could have a job in the city that they have to take, 2 subways and then go up 3 or 4 flights of stairs. They could have, they could be an athlete that they're trying to get a scholarship. And, this is like, are you kidding me? This happened to me. So the injuries are all the same, but the stories behind it and all the roles are complex and how they handle their injury and where they are in this, so you have the cycles of grief. I say, we tend to get them at like the anger and depression time, so, and then how do you, because it's a huge change in their life. So how they cope and so definitely. So a lot of times we can connect. So this, as I mentioned, so it's kind of where they're at, but then also what can we do in our experience of what we've seen, how other patients have coped? Can we bring someone in that might have, this person over there on the other side of the gym, she was just in the same spot as you a month ago. I'm going to bring you two together and just talk a little bit. So that's really important. And then, you never say as a therapist, I know. You never do. You can say, I've had a lot of patients that have struggled with what you have. Sometimes there's a cycle, like a person gets better really fast and then they kind of hang out. It takes a while to get, and this is the boring and the tedious part. And then like, do I ever get to that X? And it's also hard for a therapist to say, I'm not sure if you're ever getting back to the baseline that you want, to that athlete or to that, the person that has a neurological disorder or whatever. So they do learn. I think it's a little difficult for them that they're not going to help everyone, and they're helping them, but not what they think, that everyone's not getting back to 100%, that they're at this is what I explained to them. They're shifting a phase. They're now at a different phase in their life, and how you influence, and they never forget you as a therapist at that time. That's for sure.
Yeah, so true. And I also think, I'm sure for your students, there's also conversations about how the patient has to be a big, they have to make decisions about how they're going to take care of themselves too.
Absolutely.
It's a team
No.
effort. Yeah.
I
Yeah.
agree. Yes. So how do we motivate, and how can we help them adhere, and, we give all kinds of suggestions, and human nature,
Yeah.
of course, is a biggie. Yeah.
Yeah,
Uh,
absolutely. Yeah. Are they introduced to some kind of psychology around that process? So you mentioned that very often they're meeting people at this kind of grieving stage and may be depressed because, it's a big transition probably from where they were to where they are
yeah,
now. So
absolutely.
what
Yeah.
kind of, how is that introduced in the
Right.
curriculum?
So that's right up my alley too. So of course,
I had a feeling.
one of the requirements of to coming to the program and nationwide is they have to take a psychology class of some kind in undergrad. So that could be normal development, or it could be abnormal, or child, whatever. So that's good. Many of them actually they can be in any kind of bachelor's degree when they come. They can be musicians. So psychology is a great one if they are doing that, because they know they're going to work eventually with people that are in crisis. So this in the first summer that I mentioned that class, we do one class on communication, and a little bit on culture, and why culture. You may come across this way. I'm a loud person. I talk fast, high energy. That could totally not work with someone who is just, from a different culture, or not understanding. I'm giving too many directions.
Right,
So we just
yeah.
talk generally about that. And again, they're still new. We share different experiences. In the second year, we have a class, and it just started. It's called Psychosocial Aspects of Disability. So we look at all the parts. What are all the different avenues and areas, I should say, that are affecting why a patient is having difficulty, or they're bringing this to the table. So again, culture is mentioned again. We look at spirituality. We look at avenues that might not be good, substance abuse. We look at pain, how pain, so people that are in chronic pain, their families are just kind of like, hey, come on, you can handle it. But one day they can, another day they can't. So all the different aspects of how we would be challenged as a therapist, and that we have to understand. And, that's a lifelong process. I always say I only am as good as the experiences that I've had. I tell them, if I had my choice, go work in a large city, in a clinic or a hospital, and be involved with as many types of patients and types of diagnosis and ages. Just explode and be like, wow, there's 16 languages being spoken in this room, so it can be difficult, but wow, what a great challenge. And you learn so much. So that is really, and so they learn about that from each other. Again, there's no recipe book for this, but we also give them, the two things are, as a therapist, how does this area about substance abuse or even suicide, what do you do in your role? How do you say something to the patient? I've noticed recently, Kyle, that you seem extremely down. You're usually able to just handle our session together, but is something going on. And then they say something like, yeah, I really, I'm done with this. And you're like, okay, so then what do you say? And then, so what are the supports? And then how do you refer? And to our other mental health professionals, and what's available in the community. I say your job also, when you end up wherever you may be, you need to know in that community all the resources. So if you're a small clinic, you can call 911, but who else is around? Like the relationship with your physician. Do they have a counselor? Do they have, all these things? What are your resources in your library? What are your resources in associations that maybe someone has multiple sclerosis? Well, guess what? They have this fantastic chat room, meets every Mondays, and everyone just vents about, this is an awful diagnosis, So that is really your job, to be an advocate and know where you kind of can't be a counselor, but who can help you. Yeah. So and I think that is again, I'm going to say the problem solving part of being a physical therapist, and your brain is always thinking about, oh, I got to make sure. Oh, you know what? You would be really great with some new orthopedic shoes because you have diabetes. You need this, and all you are the reference and referral source, which is really, really an honor to be able to kind of help them in these other areas of life, even finances, right? Finances are huge. We can't fix that, but do you know that there is this association that maybe could get your child a power wheelchair? Like there's things out there.
Yeah. Yeah. And as you were speaking, I was also reminded of a slightly different topic, but another thing that's really core to you and your background and your teaching is around ethics in working with patients. Could you speak to that a little bit also?
Yeah. So I always joke around that, how did I get involved in this? This is usually one of those very dry topics, but
it's so important.
It's so important. Yeah. And it doesn't necessarily always mean, I'm going to say, doing the right thing all the time. It's actually just knowing, and this is how I present it, that in any situation, you have many options. So my goal in the third year is I'll give them a case. I'll be like, okay, think of every single option that you could do in this case, including the big one is do nothing. Just not going to do anything. I'm going to pretend I never heard this. And then you go through them. So maybe you have 10, 5 of them, no good. There's no win-win. It doesn't make a change. It's really kind of doesn't follow the legal, the legality of your practice act. So you cross those out. Okay, now you're down to your 5. Okay, so which one would be the most powerful? Which one for you would be the most difficult? A lot of times it's confrontation of any kind. Yeah. Who could you trust that you could talk to about the situation and could really keep confidence and be able to guide you? And I've had students send me an email way after they graduated. Hi, Kyle, I'm not going to give you the name of this person, but I have this scenario. What do you think? And I'd be like, you know what? You are spot on. Great idea. This is a 3-step thing. You're going to go first for your supervisor. Then you're going to go together and talk to the patient, and then so it's that kind of thing. So it's really communication, but in a larger scope and a little bit more of pressure on them that you may be like, I don't want to deal with this, but guess what? You have to, because this is a big thing. So we talk about fraud. We talk about people not practicing, the Practice Act, which is a little different in each state, kind of how physical therapy assistants can work and aids and different, boundaries that they have. So you have to be, and it's tough. Some of these are easy to fix, and some are more that you say, you know what, this is not going to be fixed, and I've tried, and I'm going to leave this job. So that, that is kind of a big thing. But so I've kind of broken it down. I mean, there's so many beautiful books on ethics and healthcare and working together. So it's a good blend. Some of my students they're like, oh, they're able to figure it out right away. And they're kind of probably in the back of the room like, Kyle, really? We have to go over this? And then other students are like, I have no idea how to fix this. So, that's kind of how we do group discussions and cases and things like that. Yes.
Yeah. Well, and I'm sure sometimes, hearing about it and thinking that how you might respond, can be different in theory than when, you're out in the field and you have, various hierarchical relationships and, and your income is dependent on things, it really changes things. And how wonderful that they, have the opportunity to kind of break it down with you while they're still students, and then coming back to you as a resource afterward, and knowing that you can give them some continued mentorship. I'm sure that makes your heart full too, knowing that that they can come to you and do. That's very powerful. So I also wanted to talk a little bit about some of the project-based learning that happens as the students are moving through your program. Could you talk about some of the projects? It seems like they have some that are at each of the different kind of years there. How is that kind of designed and presented to the
So
students?
I'll talk a little bit about the template and then just explain that if that's
Sure,
okay. Yeah.
yeah, that
So,
would be great.
so they, as I said, they do kind of that first year welcome and all about themselves. And then they
Mm-hmm.
have first, second, and third year. And they get to choose the first year and the second year, two or three, usually I think it's three classes that they really enjoyed and did some kind of project, like you mentioned.
Mm-hmm.
So, I always say to them, by the time you graduate after 3 years, you'll have every type of learning methodology, teaching methodology to you. There's group
Mm-hmm.
work and there's presentations and there's going out to a clinic. So we use
Mm-hmm.
our veterans home right on campus. And so you learn something in neurological physical therapy, but now you actually go and try it and
Yeah.
connect with one of our residents. And Chris, they have a great time. And then you debrief and be like, oh my gosh, my hand was shaking as I was trying to touch
Mm-hmm.
his arm or something, so and
Mm-hmm.
you don't realize all those things, how nervous you are. So we also have patient simulation. So you have to go in and you don't know what's going to happen. And you're being watched by your classmates in another room. And it's really, you
No
have
pressure at
yeah,
all.
no pressure. You have your lab coat and everyone's listening. And, so, and it's usually, so there's just so many great things now in education to look at it from different ways,
Mm-hmm.
and so the projects, we have a kinesiology project. They're given an area of the body, the hip joint or something that's interesting to them. And they have to create a project actually out of wood or plastic or
Oh,
something to actually demonstrate. And then we have a fair and they stand in front of their object. And then they have to explain to us how they use pipe cleaners or they use pulleys or
mm-hmm.
whatever it may be, a Play-Doh, or to make a point of how this joint works and, the mechanism. So they've taken pictures of that. And sometimes I've written a little bit about that. I actually have my curriculum map here. So let me take a quick look if there's anything else.
And I
Yeah,
love that
yeah.
that's actually shown also. So people have the opportunity to really go in and see the
Yeah,
entire
I mean, they learn a
curriculum.
lot about physical therapy by just looking
Yep.
at the different topics.
Yeah.
Each clinical experience, they do have to do a presentation so they can put that
Mm-hmm.
in service up. And I always say that, listen, you already did something in one of these classes. You can take that wonderful presentation and use it as in services. So you kind of get a twofer out of that. So
Mm-hmm.
we also have patients come in to our to our university as an example, share their stories. Also in neurological physical therapy, someone that might be have a spinal cord injury might share how, again, their kind of grieving cycle and kind of how
Right.
they found their place, and it was hard to find work that they wanted to do and then they did, and or whatever it may be. That, again, that share their road. In pediatrics, same thing. Our teacher brings she's had some of these children since they were babies all the way now. She knows them in their
Mm-hmm.
teenage years and they're growing up. So she'll have them come in and share. So we have baby day in the summer where all the babies come in because we're learning normal development. So anyone
Yes.
from 0 to 3, these kids are, they try, look at the reflexes. So the more you can
Okay.
kind of integrate, lectures and PowerPoints that you have to memorize and understand and make it come alive. And again,
Yeah.
that is a typical thing in many physical therapy programs, all different ways of interacting. And then now, the buzzword is interprofessional practice. So we've
Mm-hmm.
been doing that with occupational therapy and physician's assistant. Our school has a large event now every spring. Last year was on ethics, and we've done one, I think, on communication. So I don't know what the topic is this year, but how can we all add our piece to it if we're a
Yes.
respiratory therapist or we're, applied health informatics, whatever we may face. So, yeah. Let me see. I'll look at one more thing and give you another
Yeah.
example. In health and wellness, which is in their third year, they actually do a project on, I think it's over an 8-week period. They have someone in their life that might want to do something to get well. It could be ending
Mm-hmm.
smoking. It could be trying to get their cholesterol down. So actually, the professor sent me an email about that recently. It was one of the students' sister is a skier and wanted to get
Yeah.
fit to go back on the slopes, and every year, it's kind of like, oh my gosh, I didn't get in shape and this is tough and I might injure myself. So they put her on a 8-week exercise program, and she sent an email. She went to Colorado and she sent an email to her sister. You have no idea. I am doing fantastic. I feel limber and I feel strong. So things like that. So that's a health and wellness course, and it's trying to just show that it doesn't necessarily always have to be an injury. It could be a preventive type of look at, which that you can have a PT practice that is all about prevention and, trying to avoid some of those things that, you might have in your family or in your workplace. Yeah.
Yeah, absolutely.
So, yes.
Absolutely.
So it's good. There's a lot. As I said, it's packed.
It is definitely packed. It's definitely packed. And you can see it as you kind of go through it. And I kind of think about it as kind of unfolding the layers of their story, really. And, right from that welcome page, you often get to get a little picture. There's actual pictures, but you also just get a little picture of who the individual student is. So as you go through the various pages, you have in mind that kind of history and background and passion for what they're doing. And you can literally see that growth just being kind of manifested as you're going through and viewing their work. And you mentioned that there's certain points in some of the courses where the students do have the opportunity to actually utilize the technology in the classroom and sharing things with other peers. Do they give feedback on each other's work in those spaces, or is it more of a informal kind of sharing and storytelling and connection kind of building? I'm curious how, what levels of kind of assessment or review of the student experiences may be happening throughout the program too.
Yeah, so that's a great idea. And it's kind of changed through the years. It usually has been more informal. Sometimes we've had, it's the first and the last years, kind of their beginning and pre and post of how they gather everything together. Those are part of my courses, and it's just a percentage, and it's pretty laid out. This is what you need to do, and this is what you want to put into it. And then we definitely have, take a look at each other's and check, see again, learn about someone new. And at the end, I mentioned someone that you didn't know maybe about that person. We've done it in the middle on the second year course. We have done it in the past, kind of like as, okay, you're adding this to your second year. Sometimes it's just been an email from me. Hi guys, you're at the midpoint now of our program, please update. And then sometimes I've been like, oh, just hold on to it, but then you'll add it at the end. So it's been different, but I think that's a great point. I think it's usually more of a surprise of like, oh, I didn't know. So that kind of thing. But yeah, I mean, it's a very good suggestion. I do have, more of a rubric of just kind of, what did you include? And you were meaningful, or you went above and beyond. And I do ask, usually about 5 or 6 students of the class. I said, look, can I use your portfolio next year as examples to show to the new students, what you've done. And, some of them are just because you can change the banner and this and that and the colors and, so I was trying to go back to see when did I actually switch from paper to e-portfolios, because I only have a certain amount of years on this computer. We started we always had a large program, about 50 or 60 students, and in 2013 we split to 2 campuses close by, within an hour, and we have so I'm out here in Southampton, and then we have Stony Brook main campus. So it's 50 and 35. So I actually went back in, and I remember the first class that was out here, which would have been 2013, and they were 2016 graduates. One of our students put a video of her doing like aerial dancing with this ribbon. And I'm like, what is this? So we just laughed. And, she's super strong and she's just a great student. So I remember her. So that was definitely 2013,
Yeah, so you've got
yeah.
just a decade
It's a decade already.
these incredible experiences that your students have had. And it's wonderful that you're kind of connecting with the students before they graduate to kind of see who's ready to become an exemplar for the incoming cohort. And I'm sure as the program has kind of evolved, and as you know, Digication keeps evolving too, as we're working with different schools and learning how, different educators and students and even alumni are kind of putting it to work. So it's been such a joy to have this kind of long-term partnership and collaboration with Stony Brook so that we can all kind of celebrate that evolution together. It's always so much fun to see what the students are doing. And it's very inspiring to us to see that, and to also have the opportunity to connect to educators like you who are really providing this incredible opportunity for your students and giving them a space where they can really celebrate who they are and everything that they're learning. And I was curious if you've heard from any students after graduation, if they've been able to share it with any audiences outside of the institution. I know that some have opted to make them public, but we don't often hear, what that, next step is when they graduate.
Yeah, I actually I can't recall anyone now. I know that, when people are kind of the hot area for posting information about yourself is LinkedIn, of course. So sometimes, the idea of moving some material over, I know that they can download the whole portfolio and take it with them. We give them, I think it's an extra 6 months after graduation to have access, because then they will not have their Stony Brook emails. And most of them, as I said, if they decide to make it public or not. And usually it's within the university initially. Yeah. No, it's a great question. Sorry to say I don't have any specifics for that.
Oh,
but,
no, that's okay.
Yeah, no.
That's okay.
Yeah.
Yeah. But I wanted you to be aware too that Digication does provide unlimited alumni access. So if they did want to update their account to be with their personal credentials, if they lose access to their Stony Brook email,
that's great. I didn't know that. No, that would be great. Okay. Wonderful.
Yeah, it's definitely something that they can continue using after graduation. We do have those options to download, and of course they could get to individual files as well anytime. But yeah, we're very happy to continue hosting it for them. There's some other programs that take advantage of that too.
Okay.
So
that's good to know. Great.
Yeah, absolutely. Well, I know we're getting close to the end of our time today, Kyle, and I just really, again, wanted to thank you so much for joining me to share your experience. Again, over a decade now, using this kind of technology with your students, and so excited to be able to share what they have done and their extraordinary stories as well.
Thank you so much. My pleasure.
Absolutely. Talk to you soon.
Okay.
Bye.
Coming up next, we'll be chatting with Liz Colon, Director of Learning in Public at College Unbound. Here's a quick preview.
And I was able to use that. I was able to help create a program and a structure, that's the program that I now oversee, to figure out the ways to look at that lived experience, do a comprehensive portfolio assessment on what was learned, and then be able to bestow credit to students. It has been quite a journey for me.